Hi, Dr. Vincent with the Pain Relief and Wellness Strategy Center, here to talk about knee osteoarthritis. In addition to steroid injections, which we have discussed in previous videos, can cause significant accelerated damage to the cartilage in your joint, the MRI show further accelerated damage, leading to a knee replacement sooner than you otherwise might. Not a good long-term option if you're trying to avoid a knee replacement. Another thing that a lot of doctors might use, and this has been around since the 1990s, is what's called a Visco supplement, or some call the gel shot or the chicken shot. And it literally is from the comb of a rooster. It's hyaluronic acid. There are 7 different medications in this group. Some are far better than others. Some have a 94% success rate. Others have a 24% success rate. But it's only for early or middle stage arthritis. It doesn't prevent an eventual joint replacement. It does give you 6 months to a year of relief the first time. For early to middle stage, middle to late stage, it's not going to work very well. Second time you have it, it usually provides 4 or 5 months of relief. Third time, most people say it didn't even last till they got to the parking lot. So it is designed, actually the injection that they give you is gone from your body in about 3 to 4 days. What it's designed to do is to stimulate your body's what's called synoviocytes, the cells that make the synovial fluid in your knee. It's like the consistence of an egg yolk. And as you get osteoarthritis, that dries out. That's why things begin to creak and crack and they don't move as well and they get stiff and sore, and then the bursa sac around the knee begins to dry out and crack, and that's when you get the Baker's cyst. So the gel shots can help temporarily lubricate that. The better ones are Hyaluronic, which is actually made from the comb of a rooster, Suparts, and they're both 5 injections, 1 a week for 5 weeks. The next up would be a 3-shot Eflexa. After that, they fall off pretty quickly. Synvisc, the one that's used quite a bit. Their own literature says 24.8% of people have an allergic reaction because of all the chemicals involved in it. It's not natural like the Suparts and the Hyaluronic, and even the Eflexa. And again, it works for beginning or middle stages. It does not work for middle to late stage. So if you've had it and it's worked, that's why, but it's only slowed down. It's not reversed. There are ways to reverse it without having a joint replacement surgery. As long as you can still extend that joint, extend it out, or lay it flat on the mattress, you still have options to avoid a surgery. That's a conversation that we should have. The Visco supplement, or the gel shot, or the chicken shot, is a temporary lubricant that causes your body to make more synovial fluid to allow it to lubricate that joint. Doesn't reverse the damage it's already done to the joint, doesn't stop more damage from coming, but it does temporarily lubricate it, which should give you early stages a significant amount of relief. If you've had it and not had relief, they either use one of the less effective injections, the 1 shots or the 3 shots like a Synvisc, or they were done blinded, right? So 95% of physicians do a blind injection. They just feel and stab you with a needle. And when you use a fluoroscope, which is a motion x-ray, that's what a surgeon would utilize, you actually hit the joint 100% of the time. When you're doing a blind injection, you actually miss the joint upwards of 25% of the time in the knee, 55% of the time in the shoulder, 100% of the time in the spine. So even if you're going to have a Visco supplement, you have to make sure it's done. There are 4 stages of arthritis. It works up to about a stage 3.2 or 3.3. You start hitting the 3.5s, the 3.6s, the 3.7s and beyond. Doesn't usually last very long. Most people say, I had it, it didn't work. And or they had the lesser effective injection. They had more osteoarthritis than it was designed to handle. And again, 95% of the time it was done as a blind injection, and therefore we had a 25% chance of not even getting in the joint. There's definitely some considerations to be made. The Visco supplement is an excellent choice for early stage, and there are better choices for middle to late stage to help you not only get out of pain, but also avoid a potential joint replacement.